I'm Rebecca Davis, the Medicare Wonder Woman. And today I'm going to talk to you about enrollment periods for Medicare. These periods can become quite confusing at times. So I'm here to break them down so that you understand them and hopefully some of the confusion goes away. Now, when you are brand new to Medicare, when you're first turning 65, you're in your initial enrollment period, and you have 3 months before your birthday, the month of your birthday, and 3 months after your birthday to get onto Medicare. Now, it is important to do this earlier rather than later. As long as you do it before your birthday, then everything will be effective on your birthday month, unless, of course, your birthday is literally the first of the month. Then it's even more important to get it done sooner because your effective date will actually be the first of the month before. So if your birthday is July 1st, your true effective date will actually be June 1st if you enrolled timely. Now, if you wait till after your birthday to enroll, you can still enroll, but you are going to be delaying your effective date back. You're going to be pushing it back. So you want to enroll sooner than later. Now, let's say you get Medicare Part A and you chose not to get Part B, and you're not working, because this doesn't count if you're working and have group health. So you just chose not to have Part B insurance, and you do not have any other insurance in place that's considered credible coverage. Well, when you decide you want to get the Part B, you're going to now have to use the general enrollment period. And that is from January 1st to March 31st. And you have to enroll in Part B then, but then your effective date will not be until July 1st. So your general enrollment period is when you delayed Part B and did not have credible coverage. So then you have to enroll from January 1st to March 31st, and then you'll have a July 1st effective. Now let's talk about I.E.P, Annual Enrollment Period, which is the one that comes up every fall that you see all those crazy commercials about. It starts on October 15th and goes until December 7th. Now, this is important for people who have prescription drug plans, Part D, and people who have Medicare Advantage plans, Part C. If you have one of those two plans, then this enrollment period is very important, because this is when you find out all the plan changes for the next year. And this is the time you can make changes to your plan if you're not happy with your plan, or if your doctor no longer takes your plan, or maybe your prescriptions change. You can investigate all that and make a plan change that'll start on January 1 of the following year that may put you in a better situation than your current plan. Now, it is very important to work with your agent and make sure you update your doctor list, your prescription drug list, so they can compare it to your current plan and then compare it to all the new plans or the plans changing that's coming into your area to make sure you are still on the proper plan. This can change from year to year, so it's very important you take a look at it, especially with your prescription drug plan, because at the end of annual enrollment period, come January 1st, you are locked in once again to that prescription drug plan for a whole year, unless you have extenuating circumstances in a special enrollment period. But most people are locked in and cannot change it. So it's very important you get on the right plan. Again, annual enrollment period, also known as I.E.P, where you can change your Part C and your Part D. Now, something else to know about this is you can make as many changes as you want to this time of year, but the last change you make will be the one that comes into effect on January 1st. So if you go with option A, let's say on October 15th, and change to option B on November 7th, but you really actually wanted option A, Unless you change again, you're going to be stuck with option B. So make sure that the plan you actually want is the last one you enrolled in during the annual enrollment period, which is from October 15th through December 7th. And all those plans go into effect on January 1st. Now, there's something called OEP, Open Enrollment Period, which happens from January 1st to the end of March. This time period, you can make a one-time plan change. That's one time only plan change if you have a Part C Medicare Advantage plan. If you're not happy with your plan or your doctor doesn't take your plan or whatever reason, you can make a one-time plan change. And then that will be the plan you have for the rest of the year. During this time, you can also decide that you don't want to plan at all and go back to original Medicare and pick up a standalone drug plan. But if you have original Medicare and only have a drug plan, you cannot change that drug plan, or you cannot go back and get a Medicare Advantage plan, a Part C plan. You are locked in. The only people that can change their plan from January 1st through March 31st are people who are on Part C, known as a Medicare Advantage plan. Now, we have SEPs, special enrollment periods, year-round, depending on your situation. If you move, if you're in a disaster area, if you maybe have a chronic condition like diabetes or heart condition, if you quit your job and you had group health and you're coming off of group health, that's a very popular SEP. If you move from state to state or county to county, if there's a 5-star rated plan in your area and you're not on a 5-star plan, you can use that to switch to that plan. There are actually many SEPs available. If you really want out of your plan or you really want to switch your plan, you should work with your agent. There might be one available to you that you can use. And SEPs are year-round. Another big SEP is for somebody who's on Medicaid, maybe just got Medicaid, just lost Medicaid, just got extra help, or just lost it. You guys can choose a plan. You can switch your plan once a quarter. You can switch the first quarter of the year, the second quarter of the year, and the third quarter of the year on an SEP, one time each quarter. Now, the fourth quarter, you can't use the SEP if you're on Medicaid or extra help. You have to use the I.E.P timeframe. But there are many SEPs. Work with your agent to find out which one might work for you. So we have our initial enrollment period to Medicare, which is 3 months before our birthday, the month of, and 3 months after. We have the general election period. So if you delayed your Part B and did not have credible coverage, you can enroll in your Part B from July 1st to March 31st. It'll be effective on July 1st. You have your annual enrollment period, I.E.P, which is from October 15th through December 7th. You have OEP, which is open enrollment period, which is from January 1st to March 31st, where you can make a one-time plan change if you're on a Medicare Advantage plan. And then you have SEPs, which are year-round, depending on your situation. Now, there are several other enrollment periods available, but you're getting very complicated into the weeds. The ones I have talked about are the most common and most widely used, so ones you've probably heard on TV and things like that. I hope this helps. If you have any questions, you can reach out to me at medicarewonderwoman@gmail.com. You can reach me in my office at Cannonball Insurance Solutions, which is 254-918-5444. We're always here to help. You can even reach us on social media, Facebook, TikTok, Instagram, LinkedIn. If you send us a message, I will respond. Hope this helps. You have a great rest of your day.